Hello everyone, my name is Dr. Jitin Mishra. I'm a consulting physician in Jan Kalyan Hospital, Kalyan East. Today we are going to talk a few points about Guillain-Barré syndrome and what can be done to prevent it. So as you know, in today's world, there are multifactorial diseases, multiple times there are infective diseases also, communicable disease and non-communicable disease also. And very importantly, we have to differentiate between communicable and non-communicable disease. Non-communicable disease means diabetes, blood pressure, and communicable disease mean infective disease. Most important thing is what can be done to prevent communicable disease. And today, as you all know, there is a upcoming disease called as Guillain-Barré syndrome. In case of Guillain-Barré syndrome, what happens? Generally, it is because of some infection. Generally, let's say patient was having diarrhea or patient was having a upper respiratory tract infection. Any bacterial or viral infection can lead to antibody formation. And this antibody, what it does, after the infection subsides, the antibody it starts attacking our own cells, mainly the nerves, the peripheral nerves of the body are being attacked. And slowly, the patient starts having paralysis, and the paralysis starts from the lower limbs, and slowly it comes up to the upper limbs and later on in the chest and the face also. Once the paralysis involves the respiratory muscles, patient becomes breathless. So very importantly, if the patient becomes breathless, the patient will go on ventilator because it will take time. So most important thing is you cannot 100% prevent GBS. If a patient has to develop Guillain-Barré syndrome, the patient will develop Guillain-Barré syndrome. What you can do is you can maintain the immunity to a certain extent so that the infections which can lead to GBS can be prevented, like diarrhea, upper respiratory tract infection can be prevented. So there is a new molecule called as Imumust.
For compromised immunity disorder, tablet Imumust. Imumust is a combination of 14 herbs, vitamins and mineral is promising option to boost immunity. A must immunity booster. Imumust contains 14 herbs, vitamins and minerals which not only offers antiviral, antibacterial and antimicrobial action but also exerts immunomodulatory action. Imumust also offers ingredients like vitamin C, vitamin B6, vitamin B12, vitamin D3 and zinc which protects nerve health from damage. Imumust also controls anxiety and insomnia.
Most important thing is it will help in boosting your immunity. This immunity will ultimately help you in fighting some sort of infections, and these infections can be prevented. And if these infections can be prevented on a long term basis, Guillain-Barré syndrome can also be prevented. See, it's not 100% treatment. It will help you in prevention to some extent. If you are having any difficulty, then you should uh, visit your nearest doctor as soon as possible. Don't rely on over the counter medications. And for boosting the immunity, you have to take other multivitamins also, like multivitamins like you have to cover vitamin B1, B2, B6, B12, vitamin C, and all everything you have to take so that your immunity is for a long term basis, your immunity is maintained, and there is a low risk of communicable infections like tuberculosis also. For a long term basis, if the immunity is good, the infection rate will also be less. Okay, thank you very much.